to give an overview of what we are going to talk about today. So we have the next hour or so to speak about this topic on global health governance. So let's try to unpack first what it is, then think about why it matters, exploring some of the topics that have come up in recent times. And then I hope we can have an open discussion on a few topics. We can just have, I was thinking either a debate or just as a group discussion as well. So before we start, a few acknowledgements of those who've been helpful in thinking about this topic in the context of the Prince Mahidol Award Conference that's coming up on this topic with the sub-theme of global governance as well. But I do want to also note that what I'm presenting today is my interpretation, and any mistakes are my own. A few quick points. I think Nisa Chun has already mentioned, we are recording this session, but I hope you can share your thoughts openly. Please feel free to stop me as I go through. I will also be asking questions, so I hope you will engage. And please use chat, and if you would like to speak in Thai, I will enlist Nisa Chun's support to translate for us as well. Okay, so since there's a few of us and we have a bit of a quorum, I'll maybe ask you all to go on to menti.com and plug in this code 4747118. You'd need to go to www.menti.com. Okay, we have one person on. May I encourage the others who are also online to please join. Okay, another person. This is just to get us a bit warmed up. I have maybe 3 more people join, then I shall continue. Okay, all right, let's continue for now. Just to get us warmed up, how do respond to this question in terms of how you feel this morning? Not just for this session, but generally how you feel about today. Good, at least someone feels great. More people feel great. And at least one person is excited. All right. Okay, that's a good start, as it's a very, you may notice it's a very leading question, but it's a good way to start our day as well. So in terms of our session today, I'd like to hear from you what you think of when you hear the term global governance for health or global health governance. This is an open text. Feel free to also type in Thai. Or if anyone would just like to unmute as well, you can just unmute and say what you think of. Okay, UN agencies, code of conduct, World Trade Organization, diplomacy, health in all policies, Okay, good governance. So a lot of the multilateral institutions, issues of inequity. That's great. Okay, there's already a lot of food for thought here, so I hope we can build on it as we go along as well. But code of conduct is quite interesting in terms of an approach and what it means for global governance. So, do you think that global governance for health in this instance is relevant to your work? Okay, so most of us are directly involved. I guess with the crowd here, that's not uh, a surprise overall, but good to see that there is a unanimous view on that. And perhaps before we get started, just to hear from you what you think are some of the biggest challenges that global governance for health can address. And it could be at any level. It doesn't need to be at the global level. But yes, anything that requires a global or collective action. Pandemic agreement. Okay. Nationalism, humanitarian crises, politics, equity is a big one. Resource allocation. Okay. Points over here. Climate change and also again, yeah, economics. Um, and these are all really good points that I hope we can unpack over the next hour. So I'll now switch. I'll just pause here. And while my Zoom seems to be a little slow, so just give me a moment, please. Nisha Chun, are you able to hear me?
Yes, yes, I can hear you.
Okay, all right. I'm just maybe give me a moment. My apologies for that. And sorry to all those who had to wait. Ms. Nichachon, may I ask for your help with just sharing the slides? I'm having some trouble.
Okay, no worries. Please wait a minute, please.
Sure. So maybe while we wait for recording.
Yeah. Hi. Okay. Can you see my screen, Kun Saudamini?
Recording in progress. Yes. Thank you. And apologies. Okay. You can hear me?
You have a like echo. I'm not sure what happened, but it's not clear.
Better now? Yeah.
Okay, it's better now. Yeah.
Okay. And I think I can share my screen again. Apologies for that.
Okay, I will stop sharing.
Okay.
Okay.
Thank you. I'll just turn off my video for now, just because there might be some issues with Zoom. But perhaps just to get started, many of you are well acquainted with what global health governance is. But what I'd just like to point out as we get started is the key difference when we talk about global health governance and global governance for health. The main sort of area of focus when we say global health governance, we are talking about institutions that are dedicated to governing and managing the formal and informal mechanisms for the health sector so that it's able to work effectively to address any cross-border challenges. But when we talk about global governance for health, what we are trying to at least address is that health isn't a standalone sector. It depends on other sectors and can be affected by it both directly and indirectly as well. So this, I think some of you in the Menti before also highlighted not only WHO as the UN agency involved, but also WTO, the UN, and other actors within the space that are engaged in ensuring that the health space is managed in a more holistic manner. One of the main, this distinction was really highlighted by a Lancet Commission on this topic on global governance for health. And what they called for is that global governance for health in effect should be rooted in commitments to global solidarity and a sense of shared responsibility. And I think some of you already highlighted this aspect earlier when we talk about global governance for health. Any points to raise on this from the group? Okay, so maybe just to step back a little bit and see when did this conversation on global health governance really begin? And it's traced back to even the 19th century in many parts of the world, trying to address issues of sanitation, where countries or different states came together to try to coordinate any response for a health emergency. But one document that highlighted the global health governance literature narrative came about in 2002, which is cited here. And it came out at a time when the world was really grappling with some of the most heated debates of our time related to globalization. Some of you may be too young to remember, but others might be aware or either were directly or indirectly involved. with a lot of activities that were reacting to the process of globalization, which was changing the way countries work both within their borders and then also externally. I'm highlighting here this book called Globalization and Its Discontents. It was written by a Nobel laureate called Joseph Stiglitz. But in this, he really pointed out there was a lot of euphoria and great movement towards globalization, how it was changing economic fortunes for not only the wealthy countries, but also the low and middle income countries. But this book really highlighted the cost that it came at, including to the health sector. And then almost a decade later as well, we saw that the Lancet commissioned a paper or a report on this topic, which I alluded to earlier, on the global governance of health and what does it mean in the new era or the 21st century itself. And what the authors try to do is to really draw attention to the political determinants of health. So there was a previous commission on the social determinants of health, but here, when we are talking about governance, it is trying to look at this imbalance in the global system in terms of health risks and then power to address those risks. Many of you highlighted equity as a major issue when it comes to governance. And in many ways, that's what is at the heart of what the dialogue or debate around governance, global governance, including for health, really revolves around. In this commission, they do give some case studies, which are quite interesting. We might touch upon a few. But what it also really says or tries to advocate for is to have a cross-sectoral global action for health and setting up a multi-sectoral platform that could help address it. Now, this is where I'd just like to highlight a couple examples which could relate to, again, the global governance for health approach. Is anyone familiar with this example of when Philip Morris took the government of Uruguay to ICSID, which is the arbitration body for such settlements? Is anyone aware of this situation? Feel free to raise your hand if you want to also just share your experience. I can only see Nisachon, so please unmute as you, if you would like. So this was a very interesting example where Uruguay, following the Framework Convention on Tobacco Control, imposed restrictions or new laws for tobacco control, including using more graphic in packaging. This led Philip Morris, the tobacco company, to contend that this was hampering its sales and was contravening to the Swiss-Uruguay Treaty on trade as well. And so that's when they took the country to court. But in an interesting sort of turn of events, so even though this rather bizarre situation came about because of globalization, it is also due to globalization that the civil society network globally really came together to help support the government of Uruguay to get the legal support and be able to fight back against this lawsuit and actually win it as well. So this is an interesting case that came about and highlights again the intersectoral aspect of health. The second one, I think, though many of us will be more familiar with, is around the use of compulsory licensing for pharmaceuticals. Now, the Doha Declaration was quite a landmark one because it allowed for having these flexibilities for countries to be able to use them in order to extend health benefits to their population. And Thailand famously used them as well for HIV drugs in the 2000s. But studies have shown that even though initially there was a lot of use of compulsory licensing, over time, this has also gone down. So the reasons for that, at least maybe the jury is still out for it. But what it does highlight is, again, the need for global South governments or entities to be able to participate in a more level playing field when it comes to either trade or other such areas as well. Now, this just goes to highlight that the global health system is quite broad. We often think of WHO as one of the main entities that is leading the dialogue on global health, but countries are really quite central to it. But so are other multilateral organizations, civil society organizations, increasingly alliances, hybrid organizations like Gavi, the private sector as well, and academic institutions and donors, whether they are bilateral, philanthropies, or others as well. And they operate within the broader context with security, education, environment, trade. Just a few examples before about that, which really frame what the global health system looks like for us now. Now, the reason why we are even global governance for health would be a great thing for us. And there are many reasons why we do need it. In the context of the Sustainable Development Goals, a lot of issues that have been pointed out are about maybe more than half the population in the world still does not have access to essential healthcare, or that financing is still quite limited. And we still have issues of providing care to populations that are maybe not attached to specific countries, because otherwise they would fall within the purview of those countries themselves to support them. And this brings us to broadly three areas that still really chain down global governance. And one is around sovereignty. The global governance system is still very much anchored around the nation state. That means that in the end, countries like Thailand or others do have the final decision-making power. And we'll come back to this when we talk a bit about the pandemic accord as well. So even when we have these supranational agencies, they can give direction, but they may not be able to enforce because the decision is finally at the national government level. The second challenge, as we discussed, is that health probably never was, but increasingly is more clear, is not a standalone sector. It really interacts with all parts of our lives. And as has been shown variously, it's quite central to achieving other well-being in other aspects of life as well. However, coming back to the issue of sovereignty, even though the nation state is the final decision maker, in terms of accountability, there has been an increased openness in the types of actors who are involved in global health as well. And this has brought about an issue of accountability. There are a lot more informal actors, whether they are civil society actors, whether they are corporations, who can also operate on their own. And this creates a challenge in terms of who is governed, and by whom as well. A few other perspectives in terms of what are some of the challenges in the global governance for health sector. One, to highlight, this is from the perspective of health governance alone, is around leadership, that this is still lacking for the health sector, someone who can advocate for the health sector adequately. But also concurrently, there is limited funding and priority setting in terms of what that funding can do to push for the health needs that are most relevant or important. And in a related way, there is still a need for better accountability in the system and also transparency in terms of how decisions are made. And so there is an increasing call, as we hear, for more inclusiveness and consultative processes when it comes to any global health discussions. In the Lancet Commission, they also identify a few dysfunctions in the global health system. I'm going to highlight perhaps two. One is around institutional stickiness, which refers to many institutions have been established at a time when the power structures were a certain way, but they are not able to adapt or change adequately to reflect new realities. And this is often coming up in the context of whether it's WHO or the United Nations in general. But this also reflects the inability, perhaps, of some institutions to be able to respond to the evolving needs of their constituents and also the mega trends that engulf all of us. The second point I'd just like to highlight here is about having a policy space for health. As we hopefully all now recognize that health is not a standalone actor or sector. But when it is put in the context of other sectors, it often gets the second seat or is second to, say, economic considerations or defense or national security consideration. And it's often not given the same importance that others are. During COVID, perhaps there was more of a recognition of its importance, but this is typically a space that is missing in both national, subnational, or other conversations as well. Though there's now an increasing acknowledgement of its interconnectedness with discussions around climate change as well. I'd just like to pause and ask anyone would like to say anything so far? Okay, all right. Based on these points, just would like to highlight a few functions that have been identified around production, around the global health system. And do think of the global health system in terms of that picture of different actors within the ecosystem, the broader ecosystem of different sectors. So first, a function is really producing global public goods. This occurs when we want to create something that is non-rivalrous and non-excludable. Typically takes the form of research and development or guidelines. Can anyone give an example of one? Global public good for health? If you don't mind, I'll just call on Dr. Ankana.
Yeah, medicines and vaccine, it is right.
Yep. Exactly. And so creating or putting in funding for new medicines or vaccines, and also then producing guidelines on how they should be used. So for example, even WHO's model list of essential medicines is an example of such a global public good. So thank you, Dr. Ankana. Another function that has been identified is around management of externalities across countries. And this really comes to the fore during outbreaks. For example, establishing or having a network of surveillance and sharing of information, and also being able to perform a coordination function between countries as well. Sometimes there are systems, bilateral systems, but where the global health system comes into play is to be able to coordinate amongst multiple countries as well. An example I think some of you may be familiar with is GUAN, which is also hosted by WHO, which is a network of, again, experts that are in the field of outbreak alerts as well. A third area is around creating solidarity. So whether this stems from the development aid approach more broadly, where countries are able to finance or support other countries' development in their health systems or otherwise, but could also link to supporting marginalized populations. This has been seen as a bit of a controversial space because, again, it could sometimes undermine a national pathways for interacting with populations as well. So this is a bit of a sensitive area, but also something that the global health community is sometimes able to operate in. And a fourth area is around stewardship of the health system. I think many of you highlighted the role of WHO, and it's one that often comes up where it has perhaps the most the legitimacy to be able to act on behalf of all the actors in the system as well. Any comments from anyone? Okay. All right. So perhaps now we move from thinking a little bit about just health, but talking a little more about how this plays in the context of the post-World War II situation. Is anyone familiar with this, with the essay called The End of History? or anyone aware of the Cold War? Okay. So the Cold War was a period after World War II, which was not an active war between two countries like the World War itself, but one where two ideologically divergent countries and then their partners were basically at loggerheads. And there was always some kind of tension between that it could escalate into war. But because it created sometimes physical boundaries between countries. And here, if you see the picture below, it's the Berlin Wall, which was actually a physical manifestation of the Cold War between West Berlin, which was controlled by the United States and its allies, championing the cause of liberal democracy. Whereas on the other side, on East Berlin, which was controlled by the Russian Federation, and at the time called the USSR, and its communist allies. So this wall separated these two parts of the city because they were controlled by two different powers. But in 1989, something happened. People finally broke down the wall, and it sort of heralded this new view of at the end of history, that there was one worldview and one power that emerged from this war. And that was, at the time, the United States and the Western, allied Western powers. But since then, as we may know, the world has changed quite a bit. In the last 20 plus years, we've seen the emergence of other powers as well, notably with China. But not only China. I think this is where there is now an interest in recognizing that even though the Cold War represented a bipolar world, so you had two main sides to pick from, to then a unipolar world, seemingly unipolar world, with the United States being the main hegemon, or the one that was the most powerful and directed global policies, to now a space where there is multipolarity. So that means there are different power centers. But what some argue is that even though they may not have the same weight as either the United States or China, for example, they still have some degree of influence on global policy and action. And that's likely the direction that we are, or the space that we are in right now. And again, going back to 1945, when we had, when World War II ended, there was again a renewed sense, just the way perhaps optimism that we have right now, that we can emerge from a crisis together and try to build something in a collaborative or collective manner. And the United Nations was formed with that intent. It wasn't the first time that the world tried to create a multilateral organization. Back in after World War I as well, there was a League of Nations, but unfortunately that failed for various reasons. But the United Nations really became the symbol to create a multilateral ecosystem itself. I want to highlight, because many of us here are familiar with the UN system, and here I'd like to hear from some of you. Could anyone share perhaps what they would know about the difference between the UN and, say, the Bretton Woods institutions like the World Bank, particularly in terms of their governance or in their voting structure? So UN versus World Bank. Any idea? We are all here to learn, so please don't worry.
I guess I'm not sure, but I guess like the UN is focuses on overall, how can I say, all aspects of in global level, such as economic, health, and so on. But the World Bank focuses on economics, I guess.
Thank you. That's an important distinction too, because the UN does have a broader mandate, whereas the World Bank is, as it is a bank, is primarily focused or driven by economic and financial perspectives. But being a development bank, it can also espouse many of the development goals that are aligned with the UN too. So increasingly, we see that institutions like the World Bank, the IMF, also try to align with the United Nations. One big difference between the two, the UN has one country, one vote. So every country has equal voting power in the General Assembly. The World Bank, on the other hand, is based on the amount of shares that countries are able to contribute to. So again, here we see that there is a display of power imbalance as well. So because we call these the Bretton Woods institutions, because the World Bank and the IMF were both born out of that. And historically, the president of the World Bank has been American, whereas the president of the IMF has been European. It's sort of a balance of power between these two Western powers. Again, because they both contribute the most to these institutions in terms of their funding. In the United Nations system, at least, however, it is not necessarily the same. Even though there might be different funding allocations or contributions, each country has a vote. There is one more interesting point about the UN that I'd just like to highlight, and that's about the Security Council, which is the decision-making authority for security itself. You may be familiar that there are 5 permanent members in the Security Council. Does anyone know which they are? As a hint, it represents the victors of World War II, which is, again, the United States, the United Kingdom, France, China, and of course, Russia. So these are the 5 permanent security ones. The China seat is quite an interesting story in itself. But it's basically all these permanent powers have veto authority. So that means they can overturn any decision, even if the others agree. And this accords them quite a bit of power. And there, when we talk about reform, this is one of the areas that countries, emerging powers, have been pushing for, to have equal voting rights as well in this council too. So this is just to, again, give us a sense of where multilateralism and power come to the fore. The second level I'd just like to highlight in terms of global governance is one, we have been talking about global level institutions, but we also want to acknowledge that there are regional regional entities. And I'd like to point out first the Asian Development Bank. Does anyone know which country is one of the largest donors to the Asian Development Bank? I mentioned already that the World Bank is dominated by the United States and Europe. Would anyone know who is the biggest contributor or one of the largest contributors, and therefore shapes the agenda for the Asian Development Bank?
The US?
Interestingly, not the US in this case.
The UK?
Someone closer to us.
Singapore?
Interestingly, not Singapore either.
Someone say China?
Not yet, I think, but you're probably right. It might be soon.
Dr. Chaim and Kun Patapon say Japan, and
Yes.
Dr. Hatara
Sorry.
say Philippines.
Okay, sorry for missing the chat, and thank you, Nisa. Yes, it is Japan, which has been one of, again, has helped shape much of the dialogue or regional movement as well. And again, ADB is not only for health, and I think we are aware that perhaps health is not a focus, but more on infrastructure itself. But Japan has played a big role, and I think we are also aware when it comes to ASEAN, another regional forum, regional powers like Japan, China, as you mentioned, Singapore potentially, also come to play more of a role, which they may not be able to when it comes to global institutions as well. So this is also a mechanism for them to then have some other space to be able to exercise some degree of influence. May I also ask, you will see that there's another flag, which represents the European Union. Does anyone know what makes the European different from ASEAN? The European Commission, in many ways, has over the past few decades since World War II, it started out as an economic community, as a customs union for trade. And there was an idea that it could, the more economically integrated the countries would be, they would then be able to, they would not go to war because they are so interdependent. But it became a more political project as well. And so the European Union has the authority to regulate and set regulations for countries as well. So it is sort of a multilateral government, which ASEAN or the UN are not. And this is one distinction just to keep in mind. Now, before we just move to the next section, I want to highlight the other part that even though there, as we see that there might not be traditional spaces in the multilateral platforms for certain actors, we increasingly see other groups or other blocks being set up. So you might see one picture here of the G7, which is the group of 7 largest economies. And interestingly, this is from 2019, I think, this picture. And as you can see, there is only one woman at the table at the time in terms of global leaders. But that is the group G7 powers. There's also the G20 that comprises the 20 largest economies as well. And then if you see on the right is another acronym called the BRICS. Does anyone know what the BRICS stand for? Which countries? If you know the flags, it might be a giveaway. Well, perhaps if I will just mention here, it's Brazil, Russia, India, China, and South Africa. And this again goes back to this idea that institutions like the UN, the World Bank are not adequately evolving to respond to the changing power dynamics globally. And BRICS was supposed to be one sort of new economic bloc. They even tried to set up a new bank to cater to its own agencies, but as one would have it, they were not able to decide where it would be headquartered at the time. So just to mention again that multilateralism does push for having different countries to come together to solve problems, but they also need to be able to be agile enough to recognize differences in power and evolve, and also be able to adapt to changes over time. Any comments from anyone before we talk a little more about some health-related topics?
Yes, Saudamini, some comment from Kun Pitaporn. He says some aspects of legal binding for.
Oh, that's
Yes,
just an answer for a previous question by
okay.
Saudamini. Sorry.
Okay.
Like the difference
Thank you.
between the European Union and the rest. Thank you.
Okay, thank you.
Thank you, Pitaporn. And yes, that is one of the big points when it comes to looking at whether we want something like a European for the rest of the world as well. So with that, perhaps we'll move to the next section. So I think all of you may be already aware why the motivation for this discussion. But given today's topic, I just wanted to highlight the first sub-theme for PMAC 2024, which is on global governance for health itself. And you can see there are at least 2 topics that reflect or try to talk about how we can better address issues around medical supplies and diagnostics and innovation, but also on digital health, conflict, and then also the role of youth and climate change. So having maybe a more inclusive environment. One of the big issues that has come up in the context of global health governance is around the role of the WHO. The WHO itself has done some introspection, and it wasn't even in the recent time, it's been a decade ago almost, that there was this paper issued around WHO's role. And it acknowledged the need for WHO to redress its governance systems internally, but also to be more strategic in how it converses with other sectors as well. So it also looks beyond, it has acknowledged the need to look beyond the health sector and talk to others. And it has also identified some strategic priorities. And again, I think we are familiar with how universal health coverage has really become one of those strategic areas and how it helps align or bring together different groups towards that common goal. There has also been criticism about the WHO, one in the context, again, in whether it is able to function in an impartial enough manner to be able to be that legitimate multilateral authority that can convene different groups, and whether it is able to, again, remain relevant in this new reality that we are in, that is not simply centered around, say, some Western countries as it was in the past, but also now in a more multipolar world itself. So I hope we can talk a bit about what you think about this towards the end of this discussion. Another area, and I think Ms. Sachon had sent some readings around this, is about how global health or health in itself can be a foreign policy tool, or should it be, or is it a foreign policy to set or to be able to serve health goals as well? One might see, one part of it might seem very self-serving or selfish, but the other perhaps more as a means of being able to support broader goals. Some of you may remember the Quad. Is anyone familiar with the Quad? I didn't mention it before as one of the blocks. Anyone knows who is referred to here as the Quad? Which countries? Sorry. Quad is 4 countries. So in an effort to perhaps recognize or be able to counterweight the rise of China, 4 democratic nations of the United States, the UK, Japan, and India have come together to form this Quad. And during the COVID-19 pandemic, I think it was in 2021, yes, 2021, they had committed to produce 1 billion doses for Southeast Asia. Again, you can see geopolitics at play because they were trying to be strategic in terms of creating allies through such health policies in Southeast Asia. We also see this in the context of China. This is a reading, I think, sent by Nisa Chon. And we ourselves are privy to that as well, about the vaccine diplomacy that was employed, not just by China, but also by other countries in order to support either their foreign policy tools or in a show of solidarity during a time of health crisis. This is the lower band that you see about digital diplomacy. This is from the EU, and the reason I wanted to just highlight it is that in some cases, countries have recognized the importance of certain approaches and are thinking of how to use it strategically for their foreign policy purposes. And the EU is quite direct about using digital diplomacy, and we'll talk a bit about that when we talk a bit about AI as well. Just to highlight that there are many different paths to global health diplomacy. I think I've heard from presentations by IHPP before as well, that we also see how we can use our experience with universal health coverage to go outside and share with other countries, but then it can also be a means of going from outside to inside and be able to, again, support any progress that has been made for universal health coverage in Thailand. So it can be a strategic tool, not only for working with other countries, but then also being able to support any policy changes or policy objectives domestically too. Is everyone here familiar with the outside in and inside out? I think Kunwarisa, I have heard it from you before as well. And I think that's a very interesting example of how it has the dual role. Diplomacy has a role both externally and internally. Now, one example of where this approach of, again, not just vaccine diplomacy per se, but also having a more coordinated approach was with COVAX, which has fallen short, if not failed. in many ways during COVID-19, because we saw many countries going forward and buying directly from the market, crowding out the system for vaccines and putting basically low and lower middle income countries at the most without any vaccines for a long time, which also impacted their economic systems as well. So that's maybe one point coming out of COVID. The other, we also noticed there was a lot of vaccine nationalism that was also central to this idea around COVAX. But one big issue also was that COVAX relied on one supplier, which had dominated the market for a while. But when the time came for it to send it out, due to the COVID crisis in India itself, where it's based, the Serum Institute, it was not able to export and meet its commitments as well. So this was more of a supply side shock as well, which was at the time not adequately anticipated. And there was no way to remedy that situation immediately. But that has also spawned now more diversification strategies. So there is at least a broader effort to produce vaccines elsewhere. And just a third point when it comes around vaccine distribution is to also be able to look or consider the needs of those groups that might not fall under certain boundaries. So either and especially undocumented migrants, they often fall through the cracks. And initially were also identified, I think, as a vulnerable group, but not at the top of the list because those may not be politically defendable in many countries as well for vaccination programs. Now, I think this is an area where many of you, I think, will be more familiar around using legal instruments to perform or pursue health policy at the global or regional levels. And the two examples here are at the global level. One is the PIP framework, which tries to, again, remedy the inequality between countries. Here in the case of countries that originate or share the virus from their countries, in this case, it was Indonesia, versus being able to benefit from sharing that as well. So the PIP framework allowed for that to happen in a more equitable fashion as well. But more recently, I think some of you at least have been actively involved is in the creation of this Pandemic Prevention and Preparedness Response Accord, which tries to now build on the lessons of COVID-19 and strengthen the international health regulations, as well as create a mechanism for a more effective response. That said, I've highlighted a few key points of the accord, but what is interesting is that these points have been summarized in the UK's House of Commons in response to a petition for the government to not sign this accord. And so again, we can see what is the tension between the global and the national level systems, where countries, again, are answerable to their constituents who are taxpayers, versus, again, at the global level, where there might be an interest in having a coordinated action, but perhaps not enough of an incentive to override their domestic political concerns. In this case, the UK was one of the first, I think, initiators of the accord. So that's another point that they try to highlight, but also try to suggest about how there could be a better mechanism to create a more coordinated approach. I also wanted to highlight that Dr. Viroj, I think, is one of the co-authors that try to respond to some concerns that were raised about the accord being potentially contravening the principle of sovereignty. So whereby the nation state has the final authority to be able to make decisions. Another area that is again of interest and which we do try to address, I think, in PMAC 2 is around how governance can help address times of conflict. We are at an interesting time right now where there is an ongoing war in the Middle East, where we do see that the health system is fragile and susceptible to attacks And again, this requires, and various global entities are trying to have some kind of a ceasefire to be able to provide effective care. So this is one where it's in terms of active conflict. In some other cases, we find that the multilateral system also responds with sanctions to countries, which might offer some exemptions, like it does in the case of DPR Korea, so North Korea, in terms of allowing vaccination programs to continue. So entities like Gavi can continue to operate there. But still a lot of other items that might be required for healthcare are still governed by sanctions and they cannot have access to it. So this is another example as well. On the research side, we see that there's increasing interest on different types of in setting agenda and understanding what really are the needs when it comes to health as well. So whether it's for migration and health, or even more broadly in understanding what type of research needs to be conducted for conflict. Recently, I think the WHO also came up with a call for setting the research agenda for climate and health, which is another topic for global governance. So just as a point there. And I think this might be perhaps the last, at least case study, before I hope we can open it up to some discussion. And this is around AI. So how many of you have used ChatGPT one way or the other? You can just raise your hand. Okay, thank you, Dr. Ankana, for your honesty. And Kunisha Chol. Only two. Okay, I think the rest of us are really going to fall back. Okay, and one more. Dr. Yadativ, thank you. But the rest of us are really going to need to pick up our socks because the world is radically changing and it's moving in the direction of AI as well. So this, even though we have not recognized it, many of the global leaders have. And in November, the UK's Prime Minister, so the UK, held a global AI safety summit. And they held it very symbolically at a place called Bletchley Park. For those of you who watched the movie Imitation Game, it's where the coders of the Enigma during World War II, they worked at this place in the UK. So they held this global summit to talk about governing AI, and also had a declaration that came out of it, which was backed by many representatives. So many see this as the UK's sort of a great sort of diplomatic coup, so to speak, where they have been able to take forward, or at least set themselves up as potential leaders for setting the AI agenda. As we can see in the cartoon, though, there is some cynicism that while everyone agrees that this could be quite dangerous, secretly, they all would like to be the ones who are able to develop it and actually capitalize on it as well. It's a bit of a cynical view, but it's also perhaps a more realistic one. But that's moving from a more bilateral approach to a more multilateral one. The United Nations too has woken up or taken cognizance of AI being a powerful force. And it has established an advisory group. I think this was shared by some of our colleagues here as well. And it has, this advisory group is quite interdisciplinary. It has 38 experts, and it is hosted by the Special Envoy for Technology under the Secretary General itself. So it shows the high level of commitment within the UN system, at least, to have some kind of a roadmap to help guide us in this new age as well. So yes, I hope we can all become more savvy in terms of using AI. I think this is just to close off to say that health really does have linkages with other sectors. And so this is why it is important for us to be able to have this conversation with not just within, but also outside the health sector. And just to bring it closer to home, as we know, a few years ago, we established, or at least called for establishing APHI, the ASEAN Center for Public Health Emergencies and Emerging Diseases, which now is hosted by Thailand, Indonesia, and Vietnam to hopefully prepare us better for the next pandemic.